name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to welcome the CEO and founder of Livez, Inbal Tirosh. How are you?
Good. Excited to be here. Thank you.
Excellent. Yeah, well, welcome to the podcast. And for all of our viewers and listeners that don't know Inbal, Inbal started her career inventing the digital albums that we all use today while at Hewlett-Packard. Later in her career, she was COO at Endor Software, which was acquired by Nets Forecasts, before moving into venture at Entree Capital. Inbal sat on the boards of Tory and Magnus Metal. Also has a honors MBA from Columbia and Ben Gurion University. Inbal is very passionate about preventative care and leading Livez, which is pioneering the new era of disease prevention by turning every mobile phone into an automated screening device, enabling every individual to prevent and detect 85% of diseases early, impacting 75% of claims. So welcome to the podcast, and we can't wait to talk about you, your career, and what you're doing at Livez.
Thank you. Thank you for inviting us.
Yeah, of course.
To be here.
Yeah, we're thrilled. So Inbal, you spent your whole career in tech. You started in digital photo albums. Now you're in healthcare. What inspired you to get into the healthcare field?
I think that when you work in high tech, you can easily waste your entire career on nonsense. You don't even notice it. And I wanted to solve a problem that will impact billions of lives. I still do. That's my passion. That's why I'm in healthcare.
Excellent. So you took part in the transformation of many markets, including the digital photo albums we all use today, hybrid cloud, electric vehicles, solar energy. Tell me about those experiences and how those have helped you be really successful, upon entering the healthcare market in the last, 5 years.
I think when you look at all of these markets and what we did there, it's really it's a great satisfaction to take a complete fresh look at a problem, at a huge need, and to completely transform it, to have a different angle of doing things. And it's also extremely difficult. So sometimes you fail. And I'll give you two examples of, a success and a huge failure that I had with the photo albums that you mentioned. Back then, we all used film cameras. That's what we had. But the very early adopters, they bought digital cameras. And their problem was that all of their photos were on the camera. They couldn't really enjoy their memories. And I worked at Hewlett-Packard. I went to 70 photo labs, and I asked them if we will invent a machine that basically will get you to print digital photos automatically out of the digital camera. Will you make it work? Will you buy it? And out of 70 photo albums or digital labs, only Fujifilm and Shutterfly said, yes, let's do that. And from there on, it's history. They made it happen with us. And I think when you find the early adopters and you make the technology work, everything else is history. Everyone else comes later. Back then, even my manager, who was the VP of product strategy at HP, he said, when I'll grow hair here on the palm of my hand, we will do this crazy idea. But we did, and it became a huge success. And on the other hand, with the electric vehicles venture, it was a huge venture. We raised tons of money. I joined them at early stage, and we wanted to basically solve the dependency in oil, which is a huge mission. Mm-hmm. But our hypothesis failed. We thought that electric vehicles that we have today are not good enough. They can't become the first family car because they can't drive long enough. You can't trust the battery to go long enough. And we invented a different system, a switchable battery system, and we failed on cost and business model and maybe also timing. So I think that at the end of the day, these different experiences taught me specifically how to look at the market with fresh eyes and basically, go to the market, go to the buyer, see if they will buy it, if we will build it, and then go about building it.
So you've worked for, a couple venture-backed companies, and then, you kind of changed over to being, in venture. Why join the venture world when you did?
I think that the opportunity to leverage everything that I've learned to help multiple companies was compelling.
Hmm.
And I think I did move the needle for some. But at the end of the day, it's the founding team that steers the ship.
Hmm.
Okay, so it's the startup that actually decides on their own destiny versus the VC. So I got back to the playground.
Yeah, and what were your biggest learnings from being on the other side, being a VC for a handful of years? What did that help you do when you founded Lives?
I think back then they emphasized, which helped me a lot, was timing.
Hmm.
Basically, the understanding that if you want to build a huge company and impact, the timing needs to be perfect.
Hmm.
If you build it too soon, you will fail. You just won't have enough money to carry on until the market will adopt. If you build it too late, it's a waste of time. Don't even go about it.
Hmm.
So I think timing is key. And they basically had their own metrics on how to evaluate timing. For example, regulatory change. In our industry, it's the Affordable Care Act, which made prevention free basically for everyone, as long as you follow the protocol. Or basically, it enables insurers and employers to follow the Affordable Care Act and make prevention free.
Hmm.
And Medicare and Medicaid and value based care, which also is a lot about prevention. Timing is also about tech breakthrough. So if you see a tech breakthrough, like everything that we do, we basically say using the mobile phone as a screening device
Hmm.
will enable to make screenings easy for everyone. And for that, you need AI and PPG and computer vision and a lot of other technologies. So to have these new techs enabling what you want to build, that's also a timing that will change everything. For example, they had another way to measure it if you have a transformational event, a tectonic shift that is happening. For us, it was COVID.
Hmm.
So even the people who did prevention kind of stopped during COVID. So it was a huge trigger later on to solve it even better. So that was, I think, on top of the trivial stuff that you learn at working at VC, the way that they chose companies based on solving huge problems and the timing is now, that's something that I took with me.
Yeah, that's fantastic. Tell us a little bit about the founding story. Like, you wanted to make a big impact, you wanted to impact billions of lives. I think you hit the timing out of the park. Walk us through like any personal connection to the journey.
I think a lot of stars needs to align. So you will go ahead and build and won't just have a good idea, right?
Hmm.
We all have ideas, but to actually go and build, a lot of stars needs to align. And for me, it needs to align on the analytics. I needed to research and to understand the numbers and make it work from the analytics perspective. And then my personal experience, and then also to talk to the market and see that they will buy. So from the research perspective, when I came to realize the simple fact that 90% of the healthcare spend is on chronic conditions and 85% of these chronic conditions are preventable, I
Hmm.
said, okay, so what's the problem? Why do we have a problem? But then I've learned that less than 8% actually do their prevention on time. So when you see the solution already exists, but it's not adopted, I understood that we can solve it with technology. And the
Hmm.
technology is here with again, mobile phones, fusion of data, AI, you can solve it. You can just make it convenient without, talking about a lot of technology. You can just make it convenient. And then from the personal perspective, my husband is an interventional radiologist. So every day, basically, he used to come back home, still does, and say 90% of the people that I treated today shouldn't be there. They
Yeah.
just didn't do their prevention on time. And when you get to know some of these people, when they come to your house to get diagnosed and so on, that's really frustrating that you just build a machine that gets everyone to do that automatically, make it convenient for everyone. And then it became very personal when my father was detected late with cancer. And it caught us by surprise because we're educated. My husband is an interventional radiologist. We are well into cancers. My parents have the resources to go to the best health systems, but yet it happened to us. And then you just understand that it's everywhere. It's all
Hmm.
around us, and we can build a machine that will actually automate that for every human being.
Well, for all our listeners, I just want to make this very clear. Live started before the whole AI madness and Chat GPT. So like they were on the AI craze well before it was like in vogue. So I think that's a super important, thing to remember is, the company that's leveraging AI, is very focused on it before it was like the hot buzzword in not only healthcare, but in all of tech. Walk us through a little bit about the successes Lives have had so far. When I first heard of what you were doing and I met you, like what you explained to me was out of a sci-fi movie. And like
Yeah.
now we've seen it actually happen in real life and get some real results, which are just incredible. I think our listeners are going to be shocked at what you share.
So I think one of the biggest successes is when I wake up every morning, I can't resist. I look at the logs, okay? Because just to see the machine work in action, working when everyone is asleep, fully automated, and to just see all the people that got screened while we were asleep and all the people that get screened during the day and all the early detections. So in a nutshell, we use the mobile phone as a screening device. We enable them to get screened using the mobile phone in real time to get screened for cardio, for prediabetes, for many different cancers like lung cancer, colon cancer, skin cancer, and many more. So to see that working, people at work, at home, during the night, whatever, they get screened on their mobile phone. They get booked with in-network providers because they have a risk. So for me, one of still the most amazing successes is to see that it works at scale. People are getting screened by machines and they get into early detection with kind of effortless, completely seamless for them and for us. And then it turns into these people, these logs get faces when they just take a photo of themselves and they send us something. And it happened. They just send a thank you note. I removed the precancerous mole with you guys. I would never go to a dermatologist. I didn't even consider that. Okay. I'm a young, healthy male from California. I work at high tech. I didn't consider that. Or without you guys, I didn't have OB. I did my mammogram and I found an early detection, a very early detection. I'm 42. I have 3 kids. Thank you. So just to see this happening automatically as we speak and to understand the potential at scale, that's a huge, huge success. And I think the other thing is to gain trust of industry leaders. So whether it's leading employers or insurers, just like you said, when you look at it, you're saying, is this for real? Can you really do that? When they get, to trust that and to experience it themselves and be proud of what they're doing, I think that's the biggest success, because you can have the best technology, but it won't impact anyone unless these employers and insurers will take it to market themselves.
You shared like individual stories. Can you talk about it at scale? Like how many detections you found, like how much you've reduced cost, at which employers and health plans are you working with today? Just to give people a little bit of scale.
Yeah. So I think the numbers that we see are the same numbers that you see in clinical preventive medicine. We just did a risk detected on a mobile phone, and then we book that individual automatically within network providers. So it's the same numbers that you would hear for early detection everywhere. It's the
That's
population
incredible. You're
disease
getting
numbers.
the same percentages by using a mobile device as you would if like you're just going in person. Like that is
Because it's a
incredible.
risk assessment, and we're using the same vehicles that the industry is using just on a mobile phone. So we're using the same clinical questionnaires. We take it from the health authorities. And we're using technology that adds value and adds accuracy and removes bias on top of these questionnaires and risk assessments. So we basically get the same ratios. So it's 1 of 2 cardio screenings, they will see a risk. 1 of 3 prediabetes, 1 of 7 cancers, and we have multiple cancer screenings. 1 of 4 maternal screenings, 1 of 6 mental screenings, and so it goes on and on and on. And overall, I think that what we see, which is incredible, is that 70% of these people that they see that they have a risk on their mobile phone, they take an immediate action.
That's great.
They would immediately book an in-network provider with us. They will just click next, and they will get booked. So they will take action immediately.
And you're able to book in the app.
we just book them automatically. They need to
Mhm.
click 5 clicks. They're being booked with their choice of internet provider. Okay. So the fact that we see the same ratio and then we get 70% of them to act immediately, I think that's the great satisfaction. And today we work with Fortune 500 employers. We work with large insurers. They take it to their employers. So
Mhm.
basically it has a life of its own already. They're the stars. They put it in front of their employers.
That's fantastic. I love that. In terms of the solution, I mentioned when I first heard of it, it sounded like a sci-fi film. Didn't think it would be even possible that like technology would be at this point where you can do this, but you've shown it's possible. Like any groups that have validated this, I know you work with some of the top, consultants and brokers in the country. Any peer-reviewed published papers or data that we can share?
Fortune 500 employers that they have their own medical teams vetted it, pharmaceutical companies vetted it, large insurers vetted it. You could see the recent announcement of partnering with Chubb, which is the largest insurer globally. And beforehand with CareFirst, we sell lives to ASO, to their employers. Now working also with global groups in which their medical teams vetted it globally, because globally you need to work according to different protocols. So not just the US Preventive Services Task Force, but you need to basically comply with these different geolocations. I think for us to be vetted medically is the easy part, because we do the basics that everyone else, the traditional screenings does. We use the same clinical questionnaires and we take it from the same root source. We follow the health authorities protocols. We don't apply any judgment to it.
Mm-hmm.
So we cover all the basics. And then on top of it, we apply technology that helps you to better understand your risk with mobile screenings.
Yep.
And AI. So just taking one example, if you're getting screened for skin cancer, you're doing the clinical questionnaire for skin cancer. But then on top of that, you can just check risky moles using your phone camera. And the AI model will tell you in real time whether the mole is risky or not. Now, it's easy to vet it because instead of one provider that sees you and say, hey, this is a risky mole, I want to remove it, it's like thousands of providers which built this model for more than a decade are looking at this mole and they're saying it's risky. So it's a classic use case for AI. But I think that what you're saying is still the challenge that we experience, that although in 2024 you must adopt AI, it's just for the right use cases. I think that for some of the companies, it's still something they need to, feel very comfortable with. And today we can connect them with, other happy customers and they can easily vet it.
Yep. Yeah, I think a lot of your challenge is a lot of people are like, sounds too good to be true, but it's vetted. It is, what you say it can do. The more people that know about it, the more, diseases we're going to be able to prevent. So that's why I was really looking forward to getting you on the podcast, because I truly believe that if more employers and more health plans buy this technology, it's going to save lives. And, that's just a very, very exciting thing about having this platform, and I don't take it lightly at all. What's the difference between building a tech company or a solar energy company and a healthcare company? Like, what makes this a little bit more unique than just like all the other tech companies you worked for?
So I think everything that I was part of was tech companies. It was always tech, even if it was solar or electric vehicles or whatever, hybrid cloud, it was all tech companies. I think that what kind of surprised me about healthcare is that you really need a village. It takes a village to go to market. Okay, so when you sell in the employer space, within the employer, you would have the benefits team and the CFO and the head of HR, and then you have the broker and the insurer and the medical directors. And at least at early stage, all stars needed to align. Everyone needed to align to get in there. Okay, and now when they can just call another benefits manager, it's easier. But I think that's kind of unique to healthcare. You can't just be able to solve a problem and need that they have and go sell it. It really takes a village, and you need to know how to, to get that village to be part of the vision.
Tell us about, how you and your team built the screening solution, for diseases, at Lives. And like, how does your screening system detect 85% of preventable diseases?
So I think that the opportunity that we saw was that 85% of diseases are preventable without Lives.
Which ones are, just out of curiosity? Like, what would be a couple examples of the other 15?
I think things like Alzheimer, maybe we don't really have, a way to prevent it, and we don't even know how to cure it. So there are very specific diseases that we don't know how to prevent. We don't even know how to cure them once we detected them.
Parkinson's would also kind of be in that group.
Yeah.
Okay.
But everything that
like MS, another, like a lot of like autoimmune or neurological.
Correct. Yeah. But all the, classic things that we experience, like cancers and cardio and diabetes, pre-diabetes, maternal complications, mental health, all the chronic conditions, 85% of the chronic conditions can be prevented. So it's not like you can actually prevent them by getting screened. You can detect them early, and then you can prevent a chronic disease from evolving. Or you can prevent them altogether by vaccine, some of them. Okay. Yep. So that's what we're talking about with prevention. So our goal was to enable every individual to prevent and detect 85% of diseases early. How do you get every individual to do that? The screenings and vaccines already exist, but how do you get everyone to do that on time? And the key for us is convenience. We have this slogan internally: make it easy, convenience becomes dependence, in a good way. Okay. And then how do we do that? We said, okay, autonomous prevention. The end goal is get into a situation in which everything is done for you, effortless, frictionless, super easy on a mobile phone, because everyone has a mobile phone. And then we started to automate clinical prevention. We basically started with booking every person within network providers at the time that they need to get screened according to their individual risks. So we know what you need to get screened for. We have a plan for you, and you will get automatically booked. And we saw that people actually go. 97% of the people, when we book them, they go. They don't even reschedule. Okay. Yep. But then we said, okay, we need to make it even easier. And that's an ongoing challenge that we have. That's what we're trying to do constantly. How can we even make it easier? And then we said, we can turn the mobile phone into a screening device. So we're using different technologies for different screenings. All of them use the clinical questionnaires in order to get screened. But on top of that, we would use light reflection from your face to detect vitals, and therefore to detect the risk for cardiovascular and prediabetes and so on. We would use AI models to detect risky moles for melanoma, or to detect lung cancer by analyzing your respiration and knowing that you have a risk for COPD, or knowing your hemoglobin levels and know that you have a risk for colon cancer, or using computer vision to basically get you to pose in front of the camera and see if you have an MSK condition. So all of these screenings can be done using the mobile phone as a screening device. And that's what we started to do, to get people screened easily. And then you get these stories of, you see someone, production, logistics employees or banking employees just in their cubics getting screened. And they say, I would never get it done if it wasn't that easy. And then they get booked. So I think that to be able to completely automate prevention with today's technologies makes it easy and accessible for every individual. And that's the key. Convenience is the key. Because screenings are out there for a while. We just don't utilize it. And then to get employers to prioritize prevention over treating another disease and another disease, that's another challenge, because the system is used to treat. So we are all wired to look at the next wave of diseases: MSK, mental health, cancers, maternal complications, and so it goes on and on and on, and to find something to solve it. But you can be in a position to fix another problem and another problem, or you can prevent people from becoming chronic. And that's still a challenge, to get the market to invest in that instead of another treatment and another treatment.
Well, I've studied like buying behaviors and, what products get market fit and what don't. And ultimately, what it all boils down to, in my opinion, is does it save the end user time? Like, is that person going to save time? And this
Mm-hmm.
does both. It saves them time on the screening, and then it can save them years of their life and life expectancy and quality of life on the back end. So I really
Yeah.
love it. And, I think all of us like are pressed for time. We're all in very stressful jobs. We're overworked. We want to spend the time. We're not working with our family. It's not that we don't want to focus on preventative medicine. We just want it to be a little bit more convenient. This solves for all of that. So really, really exciting stuff. One of the things that blew me away was that, lives impact 75% of claims. Can you explain like how it does that? Because that's just such a exorbitant number.
Yeah. So I think that's where P4 medicine comes in as another term, which basically stands for personalized predictive proactive prevention. It means that we took an holistic whole person approach. We're not tackling prevention disease by disease. The treatment world is built this way. Also prevention, like biometrics, it's a very specific field. So we didn't take a specific field. We took a whole person approach, and it's easy for us because prevention is following protocols. So overall, we cover more than 50 clinical domains and 120 screenings and vaccines. And that's how we can impact 75% of claims. How come? Altogether, if you take every person and they get a plan of what they need to get screened for, their specific risks, their predicted risks according to their individual profile and individual data. And here is where social determinants of health and DNI also comes into play. Okay, so you look at every individual, and you can do that today with fusion of big data, and you take them on a journey to prevent their predicted risks, the diseases that they are likely to have because of their family history, their own history, and so on. And then you make it easy for them on a mobile phone, and you automatically book them whenever they have a risk. That's how you basically impact 75% of claims. And that's not just a founding by Lives. It's backed by the health authorities and like CDC, the US Prevention Services Task Force, and by large insurers. They did the analysis themselves to see how much claims they can save. And it gets back to the statistics that I told you that we see in the logs in the machine. 1 of 2 cardio, 1 of 3 prediabetes, 1 of 2 MSK, 1 of 7 cancers. By the way, cancers is getting to a higher ratio, okay?
Yeah.
Because with the screenings, we see 1 of 7, but 1 of 2.5 people will get cancer. So the screenings are a little bit behind. 1 of 6 mental, 1 of 4 maternal, okay? 1 of 3 vision and dental that usually we don't care much about, but it's 1 of 3 people that suffer from that. So when you see the disease ratio in the population and you have an holistic machine that knows how to screen for everything that that person needs, just following the health authorities guidelines, that's where you can have an impact at scale.
Okay. Fantastic. And, we can edit this out if I'm mistaken, but I'm pretty sure your pricing can be fully at risk. Is that true?
Yeah, it is. It is.
So why wouldn't an employer or health plan implement this? Like, what's the downside?
I think it's a matter of prioritization for employers. They're used to treat and to look at their population and say, I need to help people with weight, with prediabetes, with diabetes, with cancers. And they look at the claims and they analyze the claims in retrospect. But we look at it differently. We look at prevention. Also, our data is what's the risks that you have in your population, not what the claims that you have. So you can still do something about these risks. You can prevent them from becoming chronic, and you prevent them from becoming a claim.
Yep.
So I think that when employers are still wired to think about how can I help my population or a subset of my population that is struggling with XYZ diseases, they're trying to treat them and to give them vehicles to treat their diseases, which is very important. And at the end of the day, it's the same budget that you need to decide if you're going to treat another disease or you're going to have a holistic prevention platform for everyone.
Yep.
And I understand that it's a tough choice. Every time you have the next trend, mental health, MSK, cancers, you have the next trend, you need to do something about it. And it's hard to just say, I'm going to make a more rounded strategy and add a solution for prevention. So I won't just battle, this hill of another disease. You just have a very marginal impact instead of holistic prevention for every human being.
And the other thing I love about Lives is you're guiding these patients to other apps that can help them. So like if an employer has already purchased Hinge for MSK, they already purchased Lyra for mental health, they've already purchased Livongo for like diabetes and diabetes prevention. By having these patients get screened through Lives, the rate at which they're engaging with these apps is significantly higher than these companies are getting on their own. Can you kind of walk us through that concept?
Yeah, so 47% higher. How come? We look at it as a prevention journey. We're not doing it with Lives only. It's Lives plus in-network providers. We don't replace providers. We need them to screen and to treat people at risk. And all of these programs for treatment, we want them to move more upstream where people have identified a risk. They're not chronic yet, but they have a risk. And all of these companies that you mentioned can start help them. So whether it's Lyra or Hinge, every company that you mentioned, they can move a little bit more upstream if we channel people to them with a click of a button. Click here and you will connect to Hinge. Click here and you will connect to Lyra. Click here and you will connect to your navigator, which will help you because this is a very significant risk for cancer. Okay.
Yeah.
And for us, it's part of the before medicine. It's part of the personalized predictive prevention journey, which they don't just get screened. They start to treat themselves early before they become chronic, avoiding becoming chronic. And that's where the entire ecosystem needs to work together.
If you work at a vendor, the best thing that can happen for you is that your current customers implement Lives. You will get more of your patients engaged, and thus your company's revenue will increase, just by your customers also implementing Lives to really focus on preventative and guiding patients towards, the services already offered by the employer. So
people today,
when possible.
Yeah, I think that people are used to react to symptoms. When they feel symptoms, they will hopefully ask for a solution. They will go to a provider and maybe they will seek for a vendor that can help them with that. But when you feel symptoms, it may even be too late. You may already have a chronic condition. And if you can, this is a new market that we bring to them. If you can know that you have a risk without feeling the symptoms, that's where the magic happens. That's the real prevention. So they come in, the providers come in, and this person will not become chronic.
What do the next 5 years look like for Lives?
I think that for sure, continuing to sell directly to US employers and insurers and grow in other global markets, because what Livez is doing is needed globally. We started with the US market because in the US market, we saw that employers are paying for every claim, every disease out there, which makes the system not sustainable. They must have a solution to prevent these claims. So we started there. But the essence of what we do is needed globally. And that's where we are starting to look now, because every employer that we talk to or serve wants us to go global. They don't want just to serve their US employees. And it's a global need. And also we are a product company. We're not heavy on services. So it's relatively easy for us to grow globally as a product company that don't have a lot of local services. That's how we can grow to impact billions of lives.
Okay. Can you share your favorite story of closing a big account? You came from tech. Now you're everything. You're tech, your operations, your commercial, you as founder, CEO, you wear a lot of hats. I know you closed your first handful of customers personally. Kind of walk us through like one of the fond memories you have of one of the early companies that believed in Lives, and then obviously they've benefited since.
I think it was a long journey. It needed the village that I talked about, which was a little bit surprising for me. Okay, it's not a direct sale, and basically it started with the VP Total Rewards, who said, "Okay, very interesting concept." Okay, still not bought into that, not part of the vision, but interesting concept. And then he brought his entire global benefits team to listen to that. from India, from UK, from Amsterdam, from everywhere, like 15 different geographies. And then we said, okay, you know what, let's focus on the US first, and let's start to work with the local, the US benefits director. So we needed to go through the financial evaluation, and the CFO was involved, and looking at the ROI and the tech vetting. And then we needed to get the vetting or the acceptance of the global HR and the head of the US HR. And then we got a yes. So that was amazing because all stars needed to align. And that's also what's unique about healthcare, that you need so many partners to say yes. And then they went mute for 2 months. We didn't hear from them. And it's a struggle for me to be patient. I'm not very patient. Okay. So for 2 months, kind of trying not to push them too much. But then when they finally came back, they said, we apologize, but the director of benefits that you work with, they had an early detection of a violent cancer and they passed away, which was shocking, okay, because it happens while you're talking to a person that they don't know that they have cancer. That's the person that they work with on early detection, okay? And she was fully into the vision for her employees, but she didn't do prevention herself. So that was shocking to see. And then they signed a pilot for there are 5 largest sites. And we went on the 5 large sites, and it was very successful. And it was COVID, so we couldn't get into the site. It was all remote. And then they decided to expand to the entire US employees and spouses, everyone. And then it was such a success that they basically said, we're paying per utilizer. Can we pay a fixed PMPM? Because per utilizer, basically the utilization went off the roof. Okay, so that's an exciting thing to see that a lot of people adopted. And I think finally, for me, these people trusting me and trusting in Livez. So we need to deliver. And the 2 leaders that work closely with us, they came back to us recently. And one of them, the benefits director, just wanted a one-on-one, call. And he said, I just wanted to tell you that I'm really proud at what we're doing together with Livez. That's all he wanted to say.
Makes all the hard work worth it.
Yeah, I didn't know why he wanted a one-on-one call, and he just wanted to say this one thing. I'm really, really proud of what we're doing together because he sees the impact firsthand. It's for every employee. And then, funny enough, the senior benefits manager that we work closely together, she was in a New York event a month ago, and she called me and said, you know what? The chief medical officer of Amazon went on stage and he presented the future of solving the most acute healthcare problem, like changing the trajectory of disease and claims with mobile screenings and automated bookings. And he said that will come in 2030s. And that's why you need to be prepared for that. And she just said, we're doing it today with Livez. So I think that's a long journey that we went, and no, they didn't make our life easy. Highly professional team. And you just need to deliver.
That's fantastic. What's next for progressive P4 medicine? And for all of our listeners that don't know what P4 is, that is personalized, predictive, proactive, and prevention. Like, how do you see that space evolving over the next decade?
I think that, first of all, today, P4 medicine is the number one strategy in other continents, in Asia, in Europe, not in the US. The US is still very much focused on treatment. The US is excellent in treatment, and we need to learn how to prevent. So the challenge is still with employers and insurers to get every employee and insured to be able to enjoy P4 medicine. It's the most sophisticated form of clinical preventive medicine, and actually to be able to be monitored personally for everything that you're at risk for, and to know when you are at risk and to take action before you become chronic. That is still something that is at the hand of employers and insurers. And I think that with time, health systems will become much more efficient by shifting weight into prevention and specifically P4 medicine. So today, health systems are still very strongly about treatment, and they will dedicate more resources and they will shift focus into P4 medicine just because it makes them efficient and it reduces claims. And I think that in the longer future, the mobile phones will play, and the carriers and, Android and Apple and so on, they will have a huge, huge stake in enabling every human to get monitored in a good way and to just make healthcare very, very efficient. Not everyone should get screened. It shouldn't be protocol based. It can be based on individual risks. And when technology and adoption will be good enough, we will be able to know when we are at risk in real time and do something about it in real time. And that would be the ultimate efficient system.
Love that. Having started a few startups over your career, what advice would you give potential entrepreneurs that have a great idea before they start a business?
I think that's an easy one for me. Go and meet 30 buyers who's supposed to buy your product on the next day and see if you build it, will they buy? I see a lot of entrepreneurs starting to build, writing code, doing an MVP. You don't need that. You can illustrate what you want to do in a slide, in a mock-up, just show them, talk through what you want to do. You don't need to actually have this thing working to get a feedback if they will buy it or not. I see others going to VCs and consulting with them. Would you invest in that? The best thing that you can do for yourself, and that's also what we did with Livez. We went to 40 benefits managers, and we just asked for 20 minutes of their time, and we explained what we want to build, and we asked if they will buy.
Did they believe you could build it?
It doesn't matter. It's not a question. It's not a question. That's why you don't need to build it and to show it to them. You just need to say, let's assume I will deliver a machine that does X. Would you prioritize it? How much does it worth for you? What problems does it solve for you? Would it be your first priority or your fifth priority? Okay. Would you sign a letter of intent right now that once I build it, you will buy? Okay. That's the next step, because some of them are just being nice and saying, yeah, it's a great idea. Go do. Okay. Go build. But then they will not buy. So only when we had the first sale, we actually went to investors and started to build Livez. We didn't do that beforehand.
Interesting. That's very different than a lot of people probably would have thought. So really, really crucial insight. What are the most crucial traits a founder must have to be successful?
I think that's easy. I don't have any news there. It's determination and resilience. If you're really transforming a market, if you're creating a new category, if you're doing something huge, it's going to be very difficult. You're going to get a lot of no's, and I'm not used to all the no's that I got. You used to be successful, and you're going to get a lot of no, and you're going to get a lot of the things that the universe throw at you, like COVID and wars and what have you. You just need to be very, very determined and then you need to be very focused, and you need to know what to give up. And every day we take decisions here of what not to do. On the business side, on the product side, on the tech side, what not to do. And that's difficult decisions. You need to be very focused.
Yep, 100%. So detection and prevention, is one thing, but then what do you do with that information? Okay, you're high risk. Hey, if you go down the same path you're going, you're most likely going to have cancer or diabetes or depression or whatever it may be, musculoskeletal, issues. So I'll give an example of myself personally. My family has a history of cancer. Like in women, a lot of breast cancer. In men, a lot of like colorectal and prostate cancer. So at a very young age, I got screened. I think I was 26, 27 at the time. And back then, I'll be very transparent, I used to think that if there wasn't meat on the plate, it was a snack. Like, you can't have breakfast, lunch, or dinner without some sort of beef, chicken, fish, you name it. And so I go in, I was having some gastrointestinal issues at the time, but also they found multiple, like 6 or 7 precancerous polyps. They removed it. And my gastroenterologist sat me down and said, Norm, like, you have risk in your family. I'm glad you came in, but you got to change. Like, you can't just like do what you've been doing and expect not to have high risk going forward. he sat me down. He said, I want you to eat 90% plant-based. Like, I don't want you to not eat some of the things you love, but you got to eat it less often. And that was like a foreign concept to me. I never thought about that. But I also thought about, like, hey, at the time I was dating now my wife, I planned to have kids and a family, and I wanted to be around, for a long time. So I changed my diet, went back in 5 years later, and, I exercised. I, ate very similar to as my doctor asked. 5 years later, I had zero polyps. Like, so
Wow.
I did preventative, found that I was high risk, saw some like concerning things, changed lifestyle, and then my risk decreased significantly.
Mhm.
How do you practice what you preach? Like, you personally have started this company that's helping thousands. How do you take a lot of the preventative that you're doing, and then like put it into action with like living a wellness journey, whether that be through exercise, whether that be from de-stressing, whether that be from, eating a certain way? Like, how do you kind of live your life knowing that everything you put in your body or do or don't do physically is going to increase or decrease your risk of, certain things in your own life?
So I think that we don't need to think about risk all the time. We're not trying to optimize or to think as an insurance company how to, transform
Mm-hmm.
risk. We need to enjoy life. And my secret sauce is that, my husband is basically booking all of the screenings that I need to get done because it's easy for him. He works at the hospital. He's an interventional radiologist. And that's also when I knew that if we want to automatically book people, they wouldn't go because you can easily skip. Again, you don't feel symptoms. You can easily delay in 6 months at
Mm-hmm.
least. Okay. So I get this automated booking for myself. So I won't miss a thing. And then when you need to really change behavior, so for example, for me, it's replacing car with bike. At every opportunity, and it's not convenient, and it's very hot where I live, I would replace the car with a bike. I would bike to work and back when it's very late. I would bike over the weekends, and for every arrangement that I need to get done, I'll just bike. And I would bike with my kids, and I would not take the elevator with them. We just use our body. Okay, we walk and we bike. So much less of a car. I sit on a ball at work while I'm talking to you. I'm not standing. I'm sitting on a huge ball. Okay. And the developers at first, it was a little bit embarrassing for them to do the same, but now everyone sits on a ball at Livez. So
Very
they really
strong core
saw.
at lives. That's
Yeah.
an important key to success.
Yeah, it's just, they saw all these balls in the open space, and over time they just saw that it helps you to really avoid MSK conditions. Okay. And I basically play, I don't exercise. That works better for me. So I would play tennis. I would go windsurf. I would play. That's the only thing that can keep my mind away from work. So I would play with my kids. They also play tennis. They also windsurf. Okay. They also bike. And I think that's also to reduce their stress. These are the things like windsurf or outdoor, during the weekend. That's if I need to focus on basically windsurf, that's the only way that I won't think of work.
That's good. That's good. You got to detach. Got to
Yeah.
detach. So you mentioned like how you de-stress, how you exercise. I love it. I think it's great, to stay young at heart and still play games and compete athletically as you age and as you grow. I think the other factor in health is, other than exercise and being able to de-stress, is like what you're putting into your body. I think when people think like healthy eating, they think like Mediterranean diet, Middle Eastern diet. You living in the Middle East, kind of walk us through any healthy recipes you make at home, or any, thing that's kind of in your nutrition regimen that really helps you, feel your best and, perform your best.
I think that for me, it's everything that is not industrialized. It's kind of the way that the original shape of that thing, put in your plate. Very easy in like 20 minutes. That's what works for us at home. So it's fish in the oven. 20 minutes. That's it. Okay. You put something on it, and it's not cream and heavy stuff. It's olive oil and lemon and some vegetables, and that's it. You push it into the oven and 20 minutes, and you have great dinner. It's very, very rich salads. That's also what most of the Livez team eat for lunch. Very rich salads with like everything inside. So I think for me, it's just not to go for the industrial things that I don't know how to recognize their origin. Just to see the origin, put it, in the oven, or just eat it, vegetables and fruits the way they are.
Yeah, Whole Foods, it's kind of like
Yeah.
the diet they describe in the US, where it's like, hey, as long as you're eating Whole Foods, whole ingredients, nothing processed, you're off to a really good start. I would say it's a lot easier to eat really healthy when you have like the best hummus in the world, like right at your doorstep. So that doesn't hurt either. But I think that's another thing, like with Living to 100 documentary on Netflix. I think you add 4 years of life expectancy by eating like beans and legumes, as opposed to meat. So I think like anytime you can incorporate chickpeas or lentils or other types of legumes and beans in your diet, that's obviously going to improve life expectancy, but also like make you feel better, probably help your GI tract and give you good gut microbiome and all that type of thing. So again, Inbal, really appreciate you joining us on the Digital Health Heavyweights podcast. Really excited to see what you and Livez continue to accomplish over the coming months and years. And we'll have to have a follow-up when you get into the millions of lives impacted.
Will do. Thank you. It was great time.
Thank you. Appreciate
Thank
it.
you.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.